Well, hello everyone. I'm Chen from Biomedical Engineering Department. Welcome to join the trip to my field of research today. At the beginning of our journey, I'd like to let you to think of a question. Do you know how fast the blood flow in your liver? Well, it's a very important question because the liver is a very important organ in our body. It's located in the upper right quadrant of the abdominal cavity. And knowing about the blood flow information is very important to evaluate the function of our liver. Our liver is very important. It has many functions. It's very important for detoxification and also for the production of many chemicals and proteins for digestion. For example, it can produce bile, cholesterol, and many enzymes. If we don't take care of our liver very well, we will develop liver disease, a very common disease called liver cirrhosis. The healthy liver cell will be replaced by scarring cell, and it can be caused by many factors. For example, drinking too much alcohol, having diabetes disease, or maybe being infected with hepatitis B or C viruses. Study by the American Liver Foundation shows that liver disease has become the fourth leading cause of death in the US between people aged from 45 to 54 years old. And also liver disease kills more people than diabetes and road death combined together every year. However, 75% of people who are infected with hepatitis C virus are not aware that they have developed liver disease. So it's very important to find a way to diagnose liver disease at an early stage so that the patients can receive treatment earlier to extend their life. There are many ways nowadays to determine liver cirrhosis. For example, physical exam, blood test, and the biopsy test. All these tests have some limitations. They may not be accurate enough to evaluate the severity of liver cirrhosis, or it may not be. All the patients will feel discomfortable during the test. This comes to the imaging test, which is a very advanced technique used today to diagnose liver cirrhosis. Over the other imaging techniques like ultrasound and CT, MRI has many advantages. MRI can produce very high quality image, and it can provide it can have a better coverage of vascular systems in the liver, and to provide blood information in the liver's vascular system. And also the patient will not have exposure to radiation, which is very important for pregnant women and also for babies. Also, the patients will not feel discomfortable and are not at risk. Well, MRI is short for magnetic resonance imaging. As we all know that our body is composed of water, and each water molecule has two hydrogen atoms. These two hydrogen atoms will emit will emit a radio frequency signal when they are excited in high magnetic field. And these signals can be detected by the scanner to form the MR image. The picture on the left side shows the traditional MR scanner in hospital. And the picture on the right side shows an MR image. We can see the liver very clearly in this MR image, and we can even see the vascular system very clearly. In fact, MRI can not only use to show the anatomy and the function of the tissue, it can also provide information about blood flow. Well, in my research, I used the information of blood. I used the blood flow information from MRI scanning to compare the blood velocity in control group and patients with liver cirrhosis. Here is a picture showing a three-dimensional picture showing the vascular systems. We can see that there are three vascular systems. The focus of my research is to study the blood velocity in the arterial and the portal venous system, which are the red and the yellow parts in this figure. Well, the result shows that the mean velocity in both these two vascular systems is smaller in patients than that in the control group. And also, the percent above a specific threshold, respectively, in both vascular systems, is smaller in patients than in control group. This means that there is a difference in the blood velocity between control group and patients with liver cirrhosis, which also means that we can study the blood velocity in the liver vascular systems of a person to diagnose that, to predict that whether this person may have developed some liver disease. My next step is to measure the velocity in the individual segment of each vascular system, and also try to find other parameters that may be related to the development of liver cirrhosis. For example, the blood pressure, the peak velocity, and many other factors. I hope to prove that this automatic velocity analysis method can be used as a standardized method to diagnose liver cirrhosis at an early stage. That's all. Thank you very much.